Hello everybody, welcome to Wellness Wednesday with Dr. Lindsey, Wellness PharmD Consulting. Today's topic is allergies because allergies are everywhere right now. We're headed into springtime, things are starting to bloom, especially here in Arizona. We have lots of orange and grapefruit trees, and then the wind is blowing like crazy. I know that really kicks up some of the pollens, and so we're going to cover allergies. First off, we're going to talk about the two types, environmental and seasonal allergies. Environmental are things you're exposed to in your environment and toxins, and then seasonal allergies are the ones that come with the season, right? You're allergic to things that are blooming. Why do some people have allergies and others don't? Well, we have errors in our immune system and our genetics as our codes. So a lot of it has to do with our genetics, whether we are genetically predisposed, like most things, to allergies. You'll have an entire family that has allergies and they all see the allergy doc and they all go get their shots. I prefer not to have patients have to get shots for the rest of their life. So we're going to go over what we can do to help that. So then as you have these errors in your immune system, your genetic code, and you have allergies, sometimes that leads to like chronic sinus infections. Maybe they started viral or they started as allergies and now you've got a bacterial infection that requires an antibiotic treatment. And then you're killing the microbiome in the gut. And the gut is key to our allergies because as we get a leaky gut and our microbiome is impaired, then we get things into our system that aren't supposed to be there. And we see an increase in food sensitivities, food allergies, environmental allergies, seasonal allergies. And all of a sudden we have sugar-free, dye-free, gluten-free, dairy-free, everything. And our kids are ending up needing allergy meds younger and they're going to need shots. And so along the way, we get autoimmune disease. Well, to prevent all of that, we got to step back to when we're young. We want to have exposure. So you get exposure first in the womb, then via breastfeeding, and then the whole let them eat dirt is true. We want kids who get outside, they get dirty, kids who grow up with dogs or cats or animals, they get more exposure, and then they don't end up with allergies and as severe autoimmune diseases at an elder age because their microbiome is sturdier or more robust due to that exposure. So how do allergies happen? Well, you have something called IgE, which is immunoglobulin E, and it tells your T cells and B cells to attack. Attack. That's your histamine response. So you have this IgE hit a certain level, and that's what triggers the attack. So then some people may not develop allergies until later in life, and or it's like a bee sting. They're fine the first time, but that boosted their T cells and B cells enough that the second time they're anaphylactic and in the ER. So what do? Well, we want to down-regulate the histamine response. We want to make sure that we have proper microbiome in our gut. So we want to do a anti-inflammatory. Essentially, we want to reduce the histamine response. You can take your generics for Claritin or Allegra or Zyrtec. You can also take vitamin D because vitamin D is key to our immune system. There are vitamin D receptors on our T cells and B cells. And there was a picture before this video that showed that. So vitamin D is good to take with your allergy meds. If you have more questions and want to come off shots or things, please send me a message. And then another of my favorite products, been around 30 years. Yep, almost as longer than me. D-HIST. D-HIST is made by Orthomolecular, and it can be taken with allergy medications. D-HIST does require a loading dose. My husband used to cry every year about this time for about 2 weeks. He'd just have tears running down because his allergies were so bad. We load him in February. He takes 2 to 3 capsules for 5 to 10 days, and then he takes 2 capsules a day after that, and he no longer cries. He cries for maybe a day, not more than 2 though, and it has made his life so much better. I have friends who can now go hiking without stuffing up and running and tearing. And anyways, D-HIST is awesome because it can be taken with allergy medications. It's got bromelain, quercetin, stinging nettles, all things that reduce the histamine response and are powerful antioxidants. If you have questions about allergies or you want some D-HIST, I'll leave you the link to full script. You can just go in and type in D-HIST and order it to your house. It's $40 for 120 capsules, super affordable and well worth it not to be crying all the time. Have a great day. See you later.